Ilaria Santangelo is here, Director of Research at Patients' Right Advocate, joining us now. Hi, Ilaria.
Hi, Fawn. Good morning. Thank you for having me.
Yes, thanks for being here. So, Trump is cracking down on price transparency enforcement at our health facilities, isn't he?
Yep. When it has come to price transparency, in the past, there really has been no enforcement, leaving hospitals with little motivation or reason to comply with the price transparency law.
Yeah.
But with President Trump, the author of healthcare price transparency, back in the White House, it's our hope we'll see actual enforcement now, which we've already seen.
Yeah, and it's good because when I go in, I need to know how much is this going to be so I know if I have the funds. If I don't have the funds, it might have to wait if it's not an emergency. And then I'll get a bill for twice as much as I thought it was going to be, and that's not fun.
Oh, my gosh, yeah. Everyone has a story where they went to the hospital or the doctor expecting to pay one price and getting something completely different that they didn't see coming nor can afford, right? Price transparency fixes that. It allows the American people to have prices up front so they can know before they go and shop for the best quality of care at prices they know they can afford.
Right. And so how we doing? I mean, do we have some in our area that are doing okay, better, others maybe not?
Yeah, so what we found is we looked at 2,000 hospitals and their compliance with this law across the nation, and we found only 21.1% of hospitals are fully complying.
Wow.
In Missouri, we found 14% compliance. And the American people have every reason to believe that's going to change, as we've seen from, enforcement right off the bat with the Trump administration. But what hospitals are required to do is post these pricing files on their website. So you can go to our website, patientrightsadvocate.org. We've compiled every single hospital pricing file in the nation in a central repository where you can easily access them and search for prices.
Okay, so let's get down to the nitty gritty. If only 14% are compliant with price transparency. Of course, we can look at your list, but it's radio, so we want to talk. How are we in Cape? How are we in St. Louis? How are we?
So even if a hospital's not complying, that doesn't mean there's no prices there, right? So you can call the hospital, go on their website, ask them where their pricing file is, or go to our website. And there you'll be able to search for whatever information they do post on their website.
Okay. Now, I heard from the person who said you were going to be on that we have a hospital in Cape who is doing very well in their transparency.
Yes, let me pull up my list of hospitals. Like I said, we look at 2,000 hospitals.
Yeah,
so
I'm just going to help you out. It's called
the ones we have include are compliant are Lee's Summit Medical Center, St. Francis Medical Center, Research Medical Center, and St. Luke's Hospital. And we really applaud them for giving their community access to real prices.
Yeah, and so you know what you're going to pay, and I love that. And I wanted to push that information out so that people know Cape's doing a good job.
Huge, and we applaud them. I'm a huge fan of the Make America Healthy Again movement, and this is actually in the title of President Trump's executive order, and he understands that in order to have a healthy America, the American people can't be afraid to go to the doctor or the hospital and get the care that they need.
Yeah.
Over 1/3 of Americans are delaying care due to fear of financial ruin because they don't know what the price is going to be. And we have 100 million Americans in medical debt. Medical debt's the leading cause of bankruptcy in our country. That's like Houston, we have a problem.
Yeah.
Hospitals need to start being like Cape and posting their prices up front so all Missourians and the American people can access real prices and have that financial certainty.
And the thing that drives me the most crazy is that there are different prices if you have insurance or if you don't. Now, I get that not having to deal with the bureaucracy of insurance companies is better for the hospital and easier to do straight payment. But a lot of us don't even have health insurance. So even if we know what the price is, we still can't go.
Well, actually, let me tell you something. In these hospital price transparency files, they have to post something called the cash price, which patients without insurance can pay. And on average, the cash price is actually around 40% cheaper than any insurer negotiated rate. I'm going to give you a personal anecdote that actually I just experienced. I needed a lower lumbar an MRI on my lower back. I had hurt my back. And I'm from Boston, where we have great health care, but it's also the most expensive, right? And I was using these price transparency files and realizing I was going to pay anywhere from $3,000 to $10,000 for an MRI.
That's
I don't know about you, but that's crazy, right? So I expanded my search result, and I found that I was actually able to pay $400 cash, 45 minutes further. So I'll sacrifice that gas money to save a couple $1,000s.
Yeah, and a couple of tolls on the road. But yeah,
Exactly.
I would too. All right. So where do people find this transparency enforcement list?
So they can go to our website, patientrightsadvocate.org. We post our report. We post the hospital price transparency files. Or they can go to their hospital's website, and they should be posting their price transparency files on the bottom of the homepage. There'll be a link to the files there.
I'm so glad to hear the hospital we always go to is the one that's just knocking it out of the park. It's right up the street. I mean, I could throw a rock at it. Yeah. All right. So, Ilaria Santangelo, am I saying that correctly?
Ilaria Santangelo. Yeah.
All right. Good for me. Director of Research at Patients' Right Advocates. Make sure you go to them and see what people are saying they're going to charge, and then make sure that that's what they charge you. And if they don't do what they say they're going to do, who do they contact?
So they can reach out to us at info@patientrightsadvocate.org. We can help them fight a bill, or they can submit a complaint to the hospital.
All right. There are options, folks. You don't have to get browbeat
Exactly.
when you need some health care. I appreciate you. Ilaria, thank
Have a
you
great
so
morning.
much. Bye-bye. Happy
Thanks
Easter.
so much.
Bye-bye.